Hi everyone, we are going to discuss all the psychiatry questions which were asked in a recent FMGE exam. See here, as per expected, most of the questions they have asked from psychopharmacology and substance abuse. See all the questions one by one. See the first question now. An elderly male presented to the emergency department with complaints of pain in chest and breathlessness, but medically fit. So basically, he had the symptoms like myocardial infarction, but remember, after the investigations, he was found to be completely normal. He did not have any pathology in heart. Patient is refusing to go back home and he does not want to leave the hospital. Patient gives the history of a robbery under the gunpoint that happened 10 days before. Oh my God. So now you can understand here, symptoms started after any stress, after the trauma. So remember here, now you can rule out all other options. Avoidant personality disorder. Remember here, no, this cannot be the diagnosis here, because of the fear of rejection, person starts avoiding other people or social gathering. What about schizophrenia? No, this cannot be the case of schizophrenia. Schizophrenia is not this much acute, first of all, and in this schizophrenia you need to have the multiple symptoms, like patient can have either delusion, hallucination, formal thought disorder, right? There can be motor symptoms, there can be negative symptoms. So minimum there should be minimum or more than 2 symptoms for more than 1 month as per ICD-11, right? No? So schizophrenia cannot be the symptoms. Now, delusional disorder. First of all, this is not false belief here. Patient had one incident before. Like there is a history of a robbery. So maybe, see here, so remember, this is a case of what after the trauma, patient had the symptoms. So you can say, yeah, symptoms are like, okay, fine, PTSD for, but for PTSD, symptoms should be for more than 1 month. More than 1 month. This is called as PTSD, post-traumatic stress disorder. But here symptoms are only up to 10 days. So remember here, same symptoms like PTSD, but duration is less than 1 month. Now answer is what? Acute stress disorder. Same symptoms within 2 days is called as acute stress reaction, right? So here answer is acute stress disorder. This is a case of acute stress disorder. Next question, a middle-aged woman, BMI 32, was on atypical antipsychotic drug, presented with weight gain. Which drug is least associated with weight gain? So this is a direct question related to antipsychotic drug. First of all, when I talk about antipsychotic drug, first is first generation drug. First generation, or you can say first and second generation drug. First generation drug is also called as typical antipsychotic. Second generation is called as what? Atypical antipsychotic. Remember here, when I talk about first generation or typical antipsychotic drug, no, like haloperidol, chlorpromazine, right, flufenazine, these are having maximum neurological extrapyramidal symptoms. These are having what kind of side effects? See, remember here, mostly what? Extrapyramidal symptoms. But second generation drug, atypical, these are having what? Metabolic side effect. These are having metabolic side effect. Metabolic side effect like, remember here, hyperlipidemia, hyperglycemia, weight gain, sedation. These are metabolic side effects. So here, especially, examiner has asked question related to atypical antipsychotic presented with weight gain. And question is what? Least associated. Least. So when I talk about chlorpromazine, okay, this is what? Typical antipsychotic. So this is ruled out. Now see here, when I talk about risperidone, quetiapine and ziprasidone, I have taught you a mnemonic that is called a 𝘂𝗽𝗱. 𝘂𝗽𝗱. C for clozapine, olanzapine, ziprasidone, risperidone, aripiprazole, quetiapine. Remember, clozapine and olanzapine, especially clozapine, maximum weight gain. So when I talk about clozapine, olanzapine, these are having what? Severe weight gain. But which atypical antipsychotic drugs are neutral to weight, especially aripiprazole and amyl sulpride. So these are actually neutral, you can say. But here they are. Here in this question, Examiner is asking what least associated. So out of these options, you are going to rule out. See, remember here, risperidone and quetiapine. Okay, fine. Moderate weight gain, but minimum out of these four, it is associated with ziprasidone. Answer is C. Least answer will be what? Ziprasidone. Okay, now question number 3. A 6-year-old boy is having tapping movement. Okay, he was having lack of attention. He seems to be irritated, disturbing to others, and restless most of the time. Basically, say here, whatever question I have framed, these lines are as per the recall of medicos. Okay, so but see here, so like as per the students, they said, sir, actually this question was very, very big. Okay, fine, but almost overall the diagnosis, okay, see here, the diagnosis was overall ADHD. This was the question related to ADHD. Some more lines were there in this question. But when I talk about lack of attention, restlessness, hyperactivity, always disturbing to others, right now, roaming in the class, making so much of noises, right? Suppose if a child, especially in the boy, okay, age less than 12 years, right? Okay, this is a case of what? Attention deficit hyperactivity disorder. This is a case of ADHD. So what should be the preferred drug? Remember here there is what? Lack of attention. Okay, that's why there is what? Hyperactivity. So here we can use two drugs. One is stimulant drug, CNS stimulant. Another is a non-stimulant. Remember here, drug of choice is a CNS stimulant. Drug of choice is a CNS stimulant like methylphenidate. Methylphenidate is the drug of choice. Remember here, why drug of choice is CNS stimulant? When you take coffee or even after smoking, right? CNS will get stimulated. After that only you are having good attention, good concentration. So when CNS is stimulated, then only there will be good attention. No, here in ADHD, child is having what? Lack of attention. Lack of attention, attention deficit disorder, right now. So what does it mean? His CNS is not at all stimulated. So we have to stimulate. Drug of choice is what? Methylphenidate. Methylphenidate. But remember, CNS should not be stimulated in two conditions. This should not be stimulated in two conditions. In which two conditions can you answer me? In which two conditions can you answer me? First of all, if child is having ADHD with seizure, please do not give stimulant. Or if there is a family history of drug dependence, because suppose a father was also a drug abuser, in that child, please do not use it because there is very higher risk of dependency. So there we can use what? Non-stimulant like atomoxetine or clonidine, guanfacine. Easy to understand, bupropion. These are the non-stimulants which we can use there. So out of these four, first answer is what? Methylphenidate. Methylphenidate. Fourth question. See, this is almost similar to that question related to side effect of atypical antipsychotic drugs. Some students said, sir, two questions were there separately. Some students are saying, sir, same question. Okay, let it be. Let's see the question here. A middle-aged female was on antipsychotic drug. She started having dyslipidemia and weight gain. See here, some students said that this was almost the same question like before, like the second question what we have discussed related to the weight gain. But some students told me, sir, no, these two were separate question where especially dyslipidemia was separately mentioned. So, okay, so let's see this as a different question and let's solve it. So, which antipsychotic drug can cause these symptoms? I have taught you there are two types of antipsychotic drug. One is called as a typical antipsychotic, another is called as what? Atypical. Typical antipsychotics like haloperidol, first generation drug, right? Here, what is the most important side effect? Most important side effect is what? Extrapyramidal symptoms, right? Neurological. But atypical, what is the most important side effect here? Metabolic side effect. Metabolic side effects like hyperlipidemia, dyslipidemia, hyperglycemia, increase weight, sedation. So remember here, so especially when examiner is asking you related to dyslipidemia, then we have to consider, okay, this question is related to what? Atypical antipsychotic, second generation drug, right? So dyslipidemia and weight gain. Okay, so when I talk about haloperidol, first of all, we can rule out this is what typical antipsychotic. Now, there can be confusion in risperidone, aripiprazole, and amisulpride. These two are neutral to weight gain. Neutral to weight gain. So here, answer you should be marking what? Risperidone. Next question. A patient is presented with hypertension, increased heart rate, and sweating. He sees red halo after hearing radio. Which substance abuse can cause this? See, in this question, there is some confusion. Some students said ki no sir, red halo was not there, red urine. Some said ki sir, hematuria was there. Yeah, but so many students said ki no sir, red halo after hearing radio music or whatever. So let's see this question now. Suppose if they have asked hematuria, then it means any substance which can cause renal damage, kidney damage. If this was the question, because you people have seen the questions, right now. So as per the sentences, what we have recalled, let's solve this question now. Here, most of the students said, ki sir, red halo was there. Now, which substance abuse can cause this? Red halo after hearing radio. Okay, fine. So what does it mean? See here. See, there is something called as reflex hallucination, which I have taught you in special types of hallucination, which is also called as a synesthesia. Stimulus in one modality is going to produce hallucination in another modality. Here I have given you the example that suppose the patient is looking at the tube light, after the patient is saying that what? Sir, whenever I look at the tube light, I start hearing the voices of God. Basically, stimulus in visual, hallucination in auditory. This can be seen in substance poisoning like LSD and cannabis, right now. So here basically this is a case of what? Reflex hallucination, which is also called as synesthesia. This we see into substance abuse, like especially in what? Say here like rave drugs, LSD, right now, LSD and second important drug, that is what? Cannabis. So out of these four options, your answer is what? LSD. Remember here, stimulus in one modality, hallucination in another modality. That is called as a reflex hallucination. Stimulus in one modality, hallucination in same modality, it is called as what? Functional hallucination. These are what? Special types of hallucination. Next question. A 20-year-old boy is suffering with depression and mania. Basically, he is a case of bipolar disorder. Okay, young age boy. On history taking, it was found that he was very agitated before. Which prophylactic medicine can be given to avoid further attacks? Basically, yes, out of these four drugs, we can easily understand that what examiner wants to ask here. Especially examiner has mentioned here that boy is suffering from depression and mania, so bipolar disorder. So I have to start with a mood stabilizer. He was also agitated before. Some of you said, sir, there was a history of seizure or something like that. Might be, okay, maybe. So when I see this word here that he was very much agitated, and also out of these four, which drug you are going to choose? Okay, fine. Are you going to use only pregabalin? No, remember here depression and mania, most important thing, no? So mood stabilizer with pregabalin is the better option here, right? This is the better option of treatment. Okay, see next question. A patient feels that someone is inserting some thoughts in his mind. Or some student said, no sir, sentence was somewhat different. That patient was saying his thoughts and feelings are being controlled by external agent. So basically see here, like almost every student had different sentences. Some students said, sir, question was like this. Someone was inserting the thoughts. Okay, then answer is 100% thought insertion. Okay, fine. Some said, no sir, question was somewhat like this, where answer was exactly nihilistic delusion. My dear friends, first of all, I would like to explain you the meaning of nihilistic delusion. Nihilistic delusion, it is also called as delusion of negation. This is also called as Cotard syndrome. This is also called as Cotard's syndrome. Here, patient will be having this kind of belief that someone has stolen something from his body. Our patient is having a belief of non-existence of any part of his body. I have given you the example. Suppose if a patient is saying what? Aliens have already stolen my brain, my skull is empty, there is nothing. Okay, someone has stolen the brain of the patient. Suppose the patient is saying that my friend, he left to USA yesterday. You know what he did? He stole my pancreas and he left. So this is called as nihilistic delusion, right? Or nihilistic delusion. So I think these two sentences do not describe nihilistic delusion. Okay, fine. But now let's understand. So as per the question, if examiner had mentioned especially inserting some thoughts, 100% answer is thought insertion. Or even some students said ki no, his thoughts and feelings were influenced. Okay, then also what? Delusion of influence. Delusion of influence. Some students said ki sir, delusion of influence was not the option. Please do understand here, in both condition, remember here, nihilistic delusion is not the answer. Othello syndrome is not the answer. Othello syndrome is what? Delusion of infidelity. If a husband is having this kind of delusion, this kind of false belief that his wife is having extramarital affair, right? Othello syndrome, right? No, delusion of infidelity. Okay, this is also called a morbid jealousy, pathological jealousy. So this is also not the option. Delusion of a reference. Suppose if patient is referring for everything about himself only, okay, whatever is happening in and around, patient will refer himself. Suppose if other people are also having any kind of conversation, patient will think that they are talking about him only, okay. So here you can easily rule out answer is what? Thought insertion or maybe delusion of influence if sentence was different. Okay, question number 8. A male patient is presented with nausea, vomiting, headache, red rashes and giddiness. Family members are reporting that he was an alcoholic person before. What could be the reason for his condition, right? So basically, now we can easily see the question and easily understand. See, once upon a time, yes, he was an alcoholic person. Remember here. Now he is presented with the symptoms like nausea, vomiting, headache, red rashes and giddiness. Remember here, where we have learned about these symptoms. Do you remember something called as 𝗙𝗃𝗃 reaction? Disulfiram-like reaction. I have taught you, suppose if a patient is presenting in your department with a long history of alcohol consumption and now if he wants detoxification, right now, so how to treat alcoholism, I have taught you right now. So how to treat, first of all, detoxification with the help of what? A benzodiazepine and vitamin B1 injection. Benzodiazepine like 𝗭𝗨 epoxide. Right now, 𝗭𝗨 epoxide and thiamine for 7 to 14 days. Now, we have detoxified the patient. Okay, fine. After that, patient is supposed to be on maintenance therapy. So, for this, we can give a drug that is called as disulfiram. That is called as what? Disulfiram. See, this is a deterrent agent. This is a deterrent agent, but this can be very injurious also. Remember here, why this can be injurious? Because I have taught you. Remember here, see what is the metabolism of alcohol? Alcohol will be converted into acetaldehyde. Further, this will be converted into acetate. And finally, this will be converted into carbon dioxide and water. Remember here, one enzyme alcohol dehydrogenase and here aldehyde dehydrogenase enzyme is playing the role. I have taught you that a drug that is called as a fomepizole. See, fomepizole is going to block alcohol dehydrogenase, but when I talk about a disulfiram, this is going to inhibit what? Aldehyde dehydrogenase. Complete blockage here, irreversible. Now, when a person is already on maintenance therapy, when he is not supposed to take the alcohol again, okay, he was started on disulfiram. Remember here, disulfiram is very dangerous drug. So, before you start a patient on disulfiram, no, you have to take the consent also because patient is already on the disulfiram, which is going to block this enzyme completely, Now, after 1 month, suppose if any old friend came and now if he is going to consume alcohol again, He's already on disulfiram. Now, this enzyme is completely blocked. So now when he's going to consume alcohol, no, yes, there will be conversion to acetaldehyde, but acetaldehyde will not be converted back to acetate, and there will be no further conversion to carbon dioxide and water. So what will happen? There will be accumulation of acetaldehyde, which is an itching agent. This is going to work on some receptors like histamine, right, and serotonin. Now, when there will be accumulation of acetaldehyde, what will be the symptoms here? Now there will be red rashes. Nausea, vomiting. Okay, there will be what? Low BP, headache, giddiness. There can be seizure also. Patient can go into hypovolemic shock also. Patient can die also. This is called as disulfiram-like reaction. This is called a what? Disulfiram-like reaction or disulfiram reaction. Very easy to understand. So this question, I feel that this was actually a direct question. Some students said, no sir, question was like this, that patient had consumed a drug that is called as metronidazole, and after that these symptoms were there, and then they asked, okay fine, metronidazole also can cause same symptoms like disulfiram. You would have learned in pharmacology, you know, the drugs which can cause disulfiram ethanol like reaction. So metronidazole, isoniazid, ketoconazole, so many drugs are there, right? Now, so overall in this question answer is disulfiram like reaction. Next question. A chronic female smoker asked the physician, what will be the effects of smoking during the pregnancy? Basically, what is the question here? Effects of smoking during the pregnancy. Remember here? So there will be what? Very high risk of preterm. Yes. Very high risk of miscarriage. Remember here, there will be unexpected deaths. There can be unexpected death during infancy. Because of smoking, there will be what's here? Weak lung formation. Easy to understand, right? No, fetal alcohol syndrome, no, this is related to alcohol. So now you can easily rule out of these four options, high risk of miscarriage. Okay, no, high risk of miscarriage, high risk of abortion. Very easy to understand this question. Now, last question. A patient has symptoms like torticollis, muscle spasm, and trismus. Which antipsychotic drug can cause these symptoms? First of all, this question is related to antipsychotic drug. And when I see these symptoms, these side effects, yes, these are the symptoms of what? Acute dystonia. Acute dystonia, right now, which is one of the most important extrapyramidal side effect. This is mostly related to first generation antipsychotic typical. So out of these four, you can easily answer this question, haloperidol. Some students told me, sir, this was not the question related to drugs. This was the question related to management of acute dystonia. Okay, fine. In any condition, I have taught you all these. So first question, if they have asked which drug can cause acute dystonia, typical antipsychotic like haloperidol, because you can easily rule out other option. Clozapine, olanzapine, these are what? Second generation atypical. Alprazolam is what? Benzodiazepine. So here answer is haloperidol. Now the question is how to treat acute dystonia. Remember here, see here, acute dystonia, how to treat? You have to give what? Anticholinergic drug. So what are the examples of acute dystonia? First of all, torticollis means what? Sudden muscle contraction of neck, wry neck. There can be jaw locking, right? Jaw locking. This is called what? Trismus, laryngospasm, deviation of eyeball, sudden muscle contraction. Basically, this is what? Acute dystonia. Acute dystonia. How to treat? I think some students told me, sir, one option was there, IV benztropine. Yes, this was the answer. Then IV benztropine. Remember here, acute dystonia, how to treat? Anticholinergic, antihistaminic. So remember here, like IV benztropine, you can give a diphenhydramine. You can also use promethazine. Right. So suppose if examiner has asked you related to the management of acute dystonia, then your answer should be benztropine, right? Now, benztropine, IV injection. Easy to understand? Right. Now, one more important side effect, that is called acute akathisia. Acute akathisia means what? Severe restlessness, fidgeting of legs. Patient will not be able to sit at one place. There will be what? Severe symptoms like anxiety, right? No. So what is the drug of choice here? You can give beta blocker like propranolol. Now, so I hope you have done all these questions in the right manner, because I feel the questions were very good and most of the questions were related to psychopharma. So I wish you all the best. See, overall feedback of the exam, so many students were saying, okay, sir, so many one-liner questions were there. Okay, so much of, so much of the clinical questions they have asked. Whatever, 170 to 180 questions were doable. And I feel this time result will be good. So I wish you all the best. Stay calm, stay composed, go home and relax. For next 2 weeks, please don't think about studies and all. You have worked so hard. Please rest well, restore the energy. I wish you all the best. Thank you so much.